Karolina Zakowicz-Mietkiewicz, University of Health Sciences, Poland, to deliver her keynote presentation titled The Melanoma Prevention Program. Dr. Karolina Zakowicz graduated from Collegium Medicum in Zakowicz, Poland. She is an academic lecturer in universities providing courses connected with dermatology field. She mostly concentrates on melanoma prevention. Her scientific article was published in Scientex Cosmetology and Medicine. She has worked in cosmetology field for 17 years. Welcome. Hello, Dr. Karolina.
Hello, thank you. Hello and welcome. My name is Karolina Zakowicz-Mietkiewicz. Very nice that today I can be here with you. And my presentation is about preventions of melanoma and groups of increased risk. Okay, at the moment. Do you see my screen?
Yes, Dr. Karolina. Proceed, please.
My presentation is okay?
Yes.
Okay, it's a moment. Okay. Skin cancer are one of the most common malignant tumors found in humans due to the constantly increasing incidence of skin cancers. Their early diagnostic becomes very important, which primary in melanoma malignum at an early stage gives a good therapeutic prognosis. Many scientific works, many studies indicate the role of ultraviolet radiation in the development of melanoma. Sunburns and mainly those in early childhood are also a big risk. In most people, especially those with first skin exposure to ultraviolet radiation leads to the development of originally melanocytes nevi, besides the genetic factor. In people with a family history of melanoma, there is a mutation in the CDKN2A gene, which is responsible for two proteins, P16 and P40RF. A mutation in the CDKN2A gene may affect the exercise of inefficient expression of the above mentioned proteins, which may contribute to the formation of melanoma malignum. Melanoma accounts for only 4% of all malignant skin cancer, but is responsible for 80% of all deaths from dermatological malignant tumors. Melanoma is malignant tumor originating from melanocytes, which produce a pigment called melanin. There are four basic clinical forms of melanoma: superficial spreading melanoma, nodular melanoma, melanoma developing from lentigo-maligna melanoma, distal acrolentigenous melanoma. And this picture shows you superficial spreading melanoma, nodular melanoma, and melanoma developing from lentigo-maligna melanoma and distal acrolentigenous melanoma. Melanoma of the skin with the highest incidence occurs among Caucasian, particularly exposure to solar radiation. More than 288 100,000 cases are reported annually worldwide. For many decades, the number of melanoma cases has been growing dynamically. Over the last 30 years, the incidence of this cancer in Poland has increased by as much as 300%. Currently is about 3,500 to 4,000 cases per year, or which about 25 to 30% end in death. The result of 5 years relative survival in patients which these diagnoses have significantly improved, which may be due to the improvement of social awareness, i.e. reporting patients at an early stage of the disease and improving the diagnostic and availability of new effective therapies at the stage of more advanced stage of melanoma. The main risk factor are primarily considered to be solar radiation, sunburn and childhood and at early age, artificial radiation use in self-tanning, but syndrome of dysplastic device, and of great importance in the etiopathogenesis of melanoma malignum is the skin phototype. Everest increased risk group moles a large number of atypical giant congenital nevus. Some of them can transform into melanomas with various types of pigmented lesion. It is necessary to be more vigilant and frequent examination. More atypical, the presence of atypical lesion of the skin, more than 3, increases the risk of melanoma. Birthmarks are seen in old age as opposed a potential treat. Red hair, factor related to appearance, fair complexion, green on blue eye color, blonde on red hair, Nordic phenotype, with low melanin concentration, significantly the risk of skin melanoma. Inability to tan, i.e. a tendency to redden the skin and burns even with little exposure to sunlight. And sunburn history associated with the occurrence of skin burns in childhood. Kindred illustrating a genetic factor. People with a positive family history are much more likely to develop melanoma. In melanoma patients, survivor genes have been identified whose mutation promote the onset of the disease. Advances in the treatment of advanced melanoma were made possible by the discovery of one of them in the BRAF gene. What is the effect of the BRAF mutation in patients with melanoma? Confirmation of the presence of BRAF mutation is made by analyzing the DNA of tumor disease taken during surgery. More than half of diagnosed melanomas have a BRAF mutation. More than half of diagnostic melanoma have a BRAF mutation. Their special features are younger age of the patients. At the time of illness, the disease is more often located on the skin of the trunk, fewer features of sun damage, in the skin surrounding the primary focus. It is believed that the BRAF mutation is characteristic of people who often succumb to sunburn in childhood, and not for those who are constantly exposed to harmful sunlight. Increased number of skin pigmented nevi. Prevention include popularizing epidemiological knowledge about skin cancer and spreading pro-health behaviors, education campaigns, promotion of a healthy lifestyle, preventive examination, high-risk groups, change of worldview, early diagnostic of skin cancer through the use of many diagnostic methods. Follow-up studies in people with an increased risk factor can greatly prevent future development of skin cancer. Macroscopic assessment of pigmented lesion, application of the ABCDE rule, ugly duckling. Who does ugly duckling mean? The ugly duckling is another warning sign of melanoma. This recognition strategy is based on the concept that most normal moles or your body resemble one another, while melanomas tend of like ugly ducklings in comparisons. How do you check for the ugly duckling thing? The method behind the ugly duckling thing is for you to compare your moles with each other. And if any mole stand or look different from that of surrounding moles, is the ugly duckling, the odd mole out, the long ranger. While appreciating in this two-table progress that has been made in the field of melanoma, we are also aware of the enormity of work, especially in the field of education and change of social attitudes, which are still necessary to achieve a situation where skin melanomas will cease to be such a deadly disease. Most cutaneous melanomas are of increased risk. Prevention strategies involve mitigating the environmental risk factor and identifying individuals with phenotype risk factor for increased surveillance. Okay.